All right.
Okay.
I hope everyone's able to select their channel. So again, welcome. We are here to discuss use cases for digital and AI health competency frameworks. There's a group of us, a global group who have been working on this as a working group. So again, for the sake of time, I won't go through everyone's names. If you would like to introduce yourself, put your name, title, organization in the chat. And, we'd all be happy to connect afterwards and we'll give you some information too, and if you'd like to work on this further with us. So let's move to the next slide. All right. So the objectives of this session are that you will be able to explain the value of a competency framework and make the case for investment. You'll be able to describe the components of a competency framework and explain how these competency frameworks can be used in different contexts. So for today, our agenda is we will first start with let's see, are you able to move to the next slide?
Yeah, you know what?
I think
I must have the wrong one that I'm showing. That's embarrassing.
that's okay. Did you want to stop or do you want me to share or?
Sure, why don't you just share for the moment and so I can find the correct one. My apologies.
That's okay. I think you just need to stop sharing now. So, okay. Let's make sure that, let's see that I can do it correctly too. Let me go back into Zoom, share screen. Let's see. Do you see my full screen? Oh, no, wait a minute, that's not the right. Too many browser windows, just a second. This should be it. Oh, just a second, are you, this is where sometimes I run into Zoom issues. Make sure I've got, that's, okay, let's see now. I think something is competing with something else. Let's see if this is going to show. Huh. Are you, this is something to do with slide sharing. Are you just seeing a black screen right now? Are you guys seeing?
Yes, Alice. It's a black screen.
All right. Sorry about that. Let me, this is strange. Okay, I went into full, maybe I need to go, let me just try one more time a different way. Let's see if I do that.
Alice, let me know if you'd like me to share anything.
Let me.
Perfect. Now we can see it. Now we can see it.
The difference is when you go into full slideshows, sometimes I run into problems. Let's see. Is that working now?
It's still loading. I think we'll just wait for a couple of more seconds.
It's paused. This is the problem.
I'm good now. I have the correct one. Should I start? My apologies again for.
Same as me. I have problems with something with the full screen mode, I think. All right. Okay. Thanks, Jody. We're all able to see the agenda now. So we'll do a quick icebreaker exercise in Miro, because we'll be later on when we do the breakout group, we'll be using the Miro, which is the virtual whiteboard platform. And so this will be a way for you, if you're new to using Miro, you can start familiarizing yourself with it. So we'll do that for a few minutes and then move into the introduction to competency frameworks and our current work. Then the breakout group, and then there'll be 4 groups, and then we will return to the main group and share the results and have discussion. And by the way, I know there are people who are just joining now, so just to say something I said earlier, if you need the interpretation service, there is interpretation service in French. So on the bottom of your screen, you should have all the different Zoom icons. And towards the right, there's a globe. And if you click on it, you can choose English or French. All right. So Jody has just put the Miro link into the chat. And if you click on that link, you will see what we're seeing on the slide deck right now, a view of the world. And let's see. All right, Jody, are you actually moving into Miro itself?
I will.
Okay. So we'll show you what we're going to do there. If you all can click into that Miro link, it should put you right on that map of the world. Okay, good. We see some people moving around. So just as an icebreaker, what we thought would be nice is for people to just get to know where everyone is coming from. So you see it's a general map, and the idea is if you click on the left side that says, kind of looks like a sticky note, and select a color and then drag it over to where you're from. And you don't have to obviously get it exactly right and exactly your country. Obviously, this is a pretty tiny map for relative to the size of the stickies. So go ahead and put your sticky there. You can type your name or your initials, however it will fit. You can see Jody's demonstrating that right now. So we'll give you all a couple minutes. We'll try and make up some time later in the meeting since we're running a little behind schedule. But actually, let's see why.
So again, the sticky notes are on the side. And just pick your color.
Yeah, you can choose any color, maybe some different colors, make it interesting.
And then you can just drag it wherever you're from. Or you could just put your name and where you're from in the chat as well, whatever you're most comfortable with.
And just in terms of instruction, if you see in the bottom right, there's a minus and a plus. So that's how you can zoom in and zoom out. You can hold down the right mouse button to also move around a little bit. If you have any questions about using Miro, feel free to unmute yourself and ask questions.
How's everybody doing with the sticky notes? Are you able to get one? Because we will be using this as part of our activity. So.
And yeah, we can help. There's a little bit time to also assist in the doing the breakout if needed.
And you can size them if you click on it. You'll be able to, you can see the little corners, or you'll be able to size your sticky note as well. Oh, great. So we have from India.
Okay. Well, I see we've got a few stickies going onto the map. If you all don't mind, for the sake of time, I think I'd like to move along. If you can all obviously stay on the board if you want to, but like to keep us trying to get us moving along. So we're running a little bit behind schedule already. So hopefully you're getting a little bit of the hang of that. And so let me turn this over. Let's see, I think I know we have more people here than stickies, but I know we should. It's nice to see we have some people from the African continent and from Asia. So really nice to see that. We were hoping to reach people in both parts of the world with this particular time slot. All right, let's turn it over back to Jody.
Okay, great. Thank you. Okay, so thank you so much for sharing where you're coming from. We're really excited that you're here. So I'm just going to do a brief introduction to competency frameworks and what's a competency and the work that we've been doing, and give some examples to get us started on this. Many of you are probably already familiar with what is a competency, but I always like to start with describing what it is in a very agnostic way, so we're all on the same page. So what exactly is a competency? When you think about competencies, you think about knowledge, you think about skills, and you think about attributes or attitudes. And so a simple skill that we all learned when we were much younger about was tying your shoes. You have a series of steps that you go through to be able to tie your shoes. And that actually is something that you become competent in, is how you're able to tie your shoes. And what's interesting about competencies is that there's different ways to achieve that same competency. It's a different ways that you're able to perform that skill. And I always like asking this, if anyone feels comfortable putting in the chat, do you tie your shoes with a standard knot, or do you tie your shoes with the bunny ears? Recently, I learned I have members of my family who were taught how to do this with the bunny ears, but yet I just continue to use the standard knot. So the thing about competencies, it's a series of steps. It's something that you learn to do. It's something that's going to be measurable, and it can be done in different ways. And we follow the definition of a competency from the WHO Global Competency and Outcomes Framework for Universal Health Coverage. WHO has produced and continues to produce many competency frameworks, and they're having a standardized way of creating them as well as definitions. So this is how, when we talk about a competency, we're talking about them to be trainable and measurable. And it's to integrate those knowledge and skills and attitudes in their performance of tasks. So you tied your shoes, that was your task. It's trainable, and you measure it because your shoes are now tied. At the same time, we also talk about somebody being competent, and that's talking about the state of proficiency of the person to perform those activities. So again, we just wanted to be able to share these definitions with you, so we're kind of on the same page about what they are and what they achieve. So now going into digital health competencies, there are many competency frameworks that already exist, and these are just a few of the ones that we've been looking at. And so what we're trying to do right now is seeing what's available, seeing the depth and the breadth of these frameworks and what's involved with all of them. And we're taking these frameworks, and just to give you an example of some of the frameworks that exist, they're usually pretty much along one area. So there's going to be a lot that deals with informatics, or it's more general. But one I'd like to show you that we really like to be able to see what a competency framework could look like. This is from Australia. It's the Health Informatics Competency Framework. And as you can see here, there's 6 areas. There's 6, we use the term domains. There's 6 components. So we have the leadership, we have technology, we have health sciences, social behavior, information, and informatics. And as you can see, even though it's an informatics one, it's not just about the technologies. It's not just about how to. It also involves skills that you have in leadership and management. It also has things about science. And so that's really important to keep in mind, that a competency framework will have many different types of these areas, these domain areas. And then based on those domain areas, again, these are the 6 that they talked about. This is how they define those domain areas. With the leadership and management, you can see that they want people to apply leadership and management principles to functions, projects, and programs. And then they have ones on, like the health sciences. They want people to be able to interpret the health sciences. So this is an example of the domains, the definition of domains. And then you have your level of mastery, or you have your level of what you're able to achieve and be able to do. And in this case, they have 3 domain levels. They have, do you understand it? Are you comfortable with it? Can you apply it to your work? Or can you analyze it? And as you can see, it's kind of different levels of understanding, different levels of learning, different levels of moving forward and being competent in it. And that's really important because, all of the things that we're learning and applying in digital health, it depends on what you are doing, what your profession is, and what are those skills that you need to achieve. And then for each one of these ones, so this is the informatics one, it gets broken down into the area of skill. So these are more specific competencies. So you have this skill, or it could be a task, or it could be activity, and then it's defining what that competency statement is. What does it show to be able to achieve it? And so these are ones about appraising the structure and design of health information, the key attributes and data and information. And then, as you can see, it also has those levels. What is that level of mastery? What's that level of proficiency? In this case, all of these ones are about analyzing it. So those are pretty, hardcore areas that we are looking at in terms of being able to do this type of work. So that's an example of like a digital health competency, and all of our competency frameworks will have those domain areas. Underneath the domain areas, there'll be a listing of breaking it down into like kind of subdomains, and then really outlining what that competency is and what that level of proficiency is. So what are we doing right now based on looking at some of these frameworks? As some of you know, the WHO came out with their global digital health strategy. And as part of this strategy, there's a lot of work talking about capacity building. And there's a lot of other things talking about digital health literacy. And then obviously, to be able to do any of this, you need to have a certain level of proficiency in digital health. And so as part of this, it includes putting together a competency framework. The competency framework is also a technical product by the Digital Health and Innovation team. That Derek is one of the people that you're going to meet, who leads the capacity building unit within that department. And so as part of this digital health strategy, one of the things that will be produced is this competency framework. So we have this background in terms of the digital health strategy that we're putting together this framework so people can put it together. And then several groups have gotten together to be able to create a working group. So WHO and the group that Alice is with, I-DAIR, they have an MOU and are collaborating to put together this working group to help develop this competency framework. There's also groups that are non-state actors, that are collaborating centers, and many other types of arrangements that organizations have with WHO. And so we have this working group. We have over 60 members, and we really would love all of you to join as well. We'll give you information about joining it. And it goes across the spectrum, right? It has people from these different groups and from different professional areas, because it's not one thing, right? Digital health is inclusive of so many things, again, as you just saw. So what we've been doing is we've been meeting every other week. Recently, we've been meeting more weekly and are starting to review all of those competency frameworks that exist. We're looking, and then we're also coming up with our list of roles and what our tasks are to be able to further develop it and come up with it. Our target audience is broad. It's not just the people who are building the networks. It's not just the providers. We're really targeting all levels and all cadres in the health system. So the competency framework will be pretty broad, and in terms of how do we address each one of these audiences within the competency framework and all the domains. And then the uses of the framework, and this is what we're going to talk about very soon, a couple of minutes, is how do you use these frameworks? You can use it as part of education, which I think a lot of people would be familiar with. You can use it as part of workforce development in terms of coming up with job descriptions and job roles and occupations. Digital health occupations are new within a lot of these ministries, so helping to come up with, well, what are those skills people need? And then also about credentialing and assessment with continuous professional development. What skills do you need to get your licensure of accreditation? So these are different uses of the education, workforce, credentialing, and assessment. And then, as I mentioned before, we have these statements, and the statements, the performance criteria, how do you able to do it? What's your background you need to know, and some definitions. So, you know, as we're developing it, we're thinking about all of these different ways. And then again, we have our domain, our subdomains, our definition, and our levels of proficiency for all of these different audiences. And as I mentioned, what we've been doing within the working group is we've been looking at the different roles and looking at what all of their skills are doing. And this is one of our mirror boards in terms of coming up with those skills and attitudes and attributes and activities that they're doing to be able to come up and group those domain areas that I had previously mentioned. So that's a sort of brief overview of our work that we're doing, and we're building the competency framework. So now we really want to have an activity for the rest of the time to talk about use cases.
Yeah, thank you. Thank you, Jody, and for taking us through what a competency framework is. As you can be able to see, at least Alice had already shared the link to the mirror board. We'll be going out to our breakout session, and we have 4 case studies, or rather use case, which definitely we'll be working on. But before we go to that, it's definitely good to know which case studies we have. The first one is a combination of, all of them are a combination of 2 scenarios, where we have workforce development and the actors at the Ministry of Health. And the other one is on training and learning. The actors are frontline health workers. Another use case study, the third one is assessment and credentialing, and major actors are accreditation bodies, medical or other professional bodies that are there. And we also have training and learning, with major actors being the policy makers. And last but not least, we have the workforce development, with actors being planners and managers. And so we are going to go into the breakout rooms, and at least you have tried out. I wish Alice or somebody would have shared the, do you want me to share from my side? Just to look at the example.
If you, are you able to do that, Patrick? Yes, that's one thing we wanted to show you, is one that was filled out.
Yes, yes. Let
course
me do that.
Okay.
And share. Please confirm if you can be able to see my screen.
Yes, we see the map.
Yes, so if you zoom in, you will definitely be able to see the activities that are here. And this is the example that we have. And mainly, we are going to answer some 4 major questions as we are in the breakout room. Who will be using this framework? Depending on the use case you are assigned to as a group, who will be using the framework, and what is the context? What problem are they trying to solve, and how will that framework help? As you can be able to see here, for instance, we have the use case of workforce development, and we tend to think who will be able to use the framework, health workforce director, department or unit heads, team leaders, managers, planners, directors, something like that. And for what context? What is the context that they are working on? And so you have to create a context that you are really thinking of. So we have the digital health solutions, coming into the country rapidly. There's a lot of increased demand. And you're creating a context that will be able to lead you into identifying the problems that you are trying to solve. And so once you have created the context like that, you are going to, identify the problems that you are really in need of solving, and finally, how that framework will definitely help out. And so this is an example, a quick one. It's all of you can be able to access it and read through it. And if you go down by just using that finger thing and carrying the mirror board around, you will be able to see. So each facilitator, we have 4 facilitators. That one will be me, and Jody and Resham will be working together on another one, and Derek will also work together. Derek will work alone, and Cabello and Benson will work together on another case study. And so we are going to divide you into groups and work together with these people who will direct you on what you are supposed to do. Back to you, Alice.
Thank you. Excellent overview, Patrick. And I will hang back in the main group in case there are any questions or issues. Not sure if I'm able to visit randomly around and kind of pop into your groups or not, but I will hang back in case for any other questions. And so we are a little bit behind schedule. So the plan was to have you work together in your activity, and then we'll come back as a main group to do a report out. So let's see. I guess I'm going to cut into the report out section, if that's okay, if anyone feels differently. So let's give you all about 15 minutes. We are going to randomly assign you to the breakout group. And then so as you go through it, feel free, you saw the example where there's bullet points. You can fill it out via stickies. You don't have to have it all nicely organized as bullet points. I think this is, again, a brainstorming. So so feel free to just get the ideas out. Don't worry about if the formatting is exactly following a consistent way. All right, so we'll give it 15 minutes. Come back at about, at least I'm according to my clock, it'll be about 47, 48 minutes into the hour. I think, Amanda, are you able to split us up?
Yes.
Great. Thank you so much. I'll see you guys all in 15 minutes. Okay, so it's just
Alice,
Mhm.
yeah, it's just us now. Could you, what time do you want them to come back again? You said 40 what?
So at 48 minutes to the hour, I want to know where
Okay.
you are. It'll be 1:48.
Okay, I would. Okay, perfect. So I would just send a 5-minute warning to to everyone. So I just want to know the time. So I'll send a 5-minute warning, and then you can just let me know when to bring them back as well.
Great.
And I think you can also pop into the rooms if you want to.
Okay, yeah, because I'm just seeing that. So I can join and come back then, and you all are
Yeah,
back?
you can. Yeah, you can join and come back.
Okay, let me just see if, I see there's only one person in the group with Derek. Let's see,
Let me see.
let me check in with Cabello and Benson. Let's just see how they're doing.
Okay.
I'll just join them briefly. Let's see.
Okay. Hi, Alice. Oh, sorry, you're muted.
Hi, sorry. How are you? How's it going?
Yeah, it's going okay. Just to clarify again, you're coming back at 1:48.
Mhm. Yes.
Okay.
Yeah.
Okay, great. Thank you.
Let's see how. Let me check in with Derek. Let's do that. Okay, I'm just going to keep jumping between rooms. But very quick question. Was there anyone in the French channel?
No, they're all here. All the interpreters are here. So I doubt. I don't know. I have no clue. I couldn't check on my end.
Okay. Was there, I guess for the interpreters, was there anyone in the French channel? I have a feeling probably not. Let me just jump.
Hi, Jody. Can you hear me?
Yeah,
I'm
my
okay. Should I just put you back in room 2?
Can you please? Thank you.
Yeah, okay.
Something,
Yeah.
okay, I'll join Resham, I'll join your group too.
Hi, Alice.
Hi, yes.
Should I
yes.
go ahead and close our rooms? Okay.
Just give people, yeah, like that 1 minute warning, some whatever that, I think there's some kind of option like that, right?
Yeah, I already gave that
Oh.
47.
Oh,
Okay. So should I go ahead and close it?
Sure. If you already gave the warning.
Okay.
Sure. Great. We're all coming back to the main room. And hopefully we didn't lose anyone along the way. I hope that was a good experience. Maybe I wonder if you, if there's to hear your reactions, but let me turn this over. Maybe that's during the report out, you can let us know. Let me turn this over to Derek to lead the final portion of this session, to have report outs from each group and a discussion. So over to you, Derek. And I guess, do we need to share the slides again? Let me check. Derek, are you doing that yourself?
If you could share from your site, then I'll speak. So welcome everybody. Hopefully you had a good engagement in the breakout sessions. Now is the time to have a joint experience and reflections from what just happened. We'll grow in sequence. Just call out the groups from the top. So group 1, 2, 3, and 4, as was presented by my colleague previously. So let's kick off with group 1, the use case on training and learning. Actor from frontline health workers, calling on group 1 to take the floor. And
Linda, do you want to go ahead and share?
Yeah, sure. I'll go ahead. So hi, I'm Linda Taylor from Digital Square, and I have had some exposure to this work around the competency frameworks over the last, I guess, couple of months or so. So I do have some context, but I did find it really useful to take a step back as to why these frameworks are important and who's going to be using them. So what we built out there is, in terms of who's going to be using it, obviously the frontline health worker is at the core, but many others, like, the team leaders, the people who are going to create the content for the training, the people who are going to be delivering the training, the senior management, health directors, and so on, for planning purposes, HR in terms of, looking as to how this fits into career paths and remuneration and the rest of it. And the context, we talk very much about, learning how to use these new digital health tools effectively, and also how to make better use of the data that comes out of those tools, because there's so much happening in terms of, new ideas, new technologies all the time. Problems they're trying to solve, ultimately delivering better care to their patients, and this is where those kind of longitudinal patient records and interoperable systems should be working towards that as well. Producing better data for decision makers and just better use of those tools. And the framework help really in terms of providing minimum training standards, helping in terms of what's, planning how to deliver that, communicating that same information, and of course then building the skills, but also that recognition of the skills, which hopefully over time will keep to sort of retention of skilled staff. So that's a very quick overview of our group. Thanks.
All right, thanks, Linda, and thanks, Patrick, for that overview. We'll perhaps go through the groups and then have a general discussion at the end. Let's go to the second group. Jody and Rashlan, over to you. And the second group is looking at assessment credentialing, and the actor is basically professional health associations and accreditation bodies. Jody and Risham.
Rasham or Akash, do you want to just give a broad overview?
Akash, I think you filled quite a bit. Would you like to speak?
Sure.
I think you've added some really good inputs that'll be really helpful.
Hi, thank you. And I'm Akash from Accenture. So in terms of who will be using the framework, apart from the accreditation body and professional associations themselves, we expect the providers and the health workers. By health workers, I mean frontline workers, such as it could be community health workers, it could be midwives, etc. And from providers, I mean doctors. The government certification agency, which is the accreditation body, and then training agencies and health education bodies who are going to conduct the training and learning, as well as hospitals and the health posts who will employ these doctors, or health posts, for example, who will utilize the FLWs. They will use this framework. In terms of the problem which they're trying to solve, from an accreditation body point of view, they're trying to ensure that the quality of care will be maintained based on their credentialing and assessment. The matching the capacity building program to the credential will be a key part of that, and building the literacy levels for adoption of the digital health by frontline workers will also be a part of this. The framework can help ensure that the digital literacy levels of frontline workers are enough to adopt the solutions, that it's not on the mirror board yet, but the hospitals have enough information to employ capable enough doctors with high competency, which is high enough for delivering these services are there. And that's the overview of this use case. Thank you.
All right, thank you so much, Jody and a group. So moving on to the third group that dealt with the third use case on training learning, and the actor is the policymaker, and have the pleasure of calling myself to the floor. I'm Derek Kumene, Head of Capacity Building and Collaboration at WHO. I was with Anita, and Anita, check in if you are able to report out on what we have. Okay, I'll report on behalf of Anita and myself. We're looking at the policymaker, and the use case was in-service training. In terms of the first question, who would be using the framework? So we had a number of actors here, ministers of health, permanent secretaries, human resource deployment directors, departmental directors in charge of deploying health workers and also managing their training, the heads of missions, the civil service deployment agency, and civil service educational bodies. In terms of the context, we have a couple of reflections here. If you could zoom in a little bit, the sticky notes are a little bit small.
Just a quick note, Derek, we have 4 minutes left, so I'm not sure. It might be kind of strict because I think they're back-to-back sessions.
All
so
right.
Apologies.
Okay.
Sorry, we'll have to be quick.
1 point per each block now. In terms of the context, so I think the main context here was really making sure that continuous professional development, CPDs, are integrated with digital health learning opportunities. In terms of what issue they're trying to solve, one of the issues that we talked about here is fragmentation of different learning opportunities that leads to inconsistencies in CPD points. And then lastly, in terms of how the competency framework would help, course curation, for example, and at the same time certification and accreditation. Okay, that's our group. Let me quickly go to the last group, given that we are short of time. Calling on the last group that dealt with workforce development. Carvelo and Benson, over to you.
Okay, so we looked at that particular area where the use case is workforce development and actors are planners and managers. And we had physicians, policymakers, healthcare managers forming the thought of who will be using the framework. And the context here, looking at issues of like defragmentation of health information systems and the problem that they're trying to solve, basically improving health service delivery, reducing costs and inefficiencies. Unfortunately, we were not able to go on and complete the last block. Thank you.
All right, thank you very much. We have a few minutes before you close. So maybe I'll pause here in case there's one participant that would want to voice out as we graduate towards the closing. Okay. All right, we are running out of time. So I suggest we go towards the closing section, and I'll ask Alice to help us with deploying the screen for the closing statement.
Okay. Do you see?
All right. Yeah. Yes, I do. Just want to thank dear participants for wherever you're connecting for a robust discussion, great content. Competencies, as was mentioned by my previous colleagues, are quite important in terms of enabling the health workforce. For further conversations, you have the contact information on the screen. You have Alice's email, my email, and Jody's email. Do feel free to contact us for further information. I'll hand back to our colleagues that were helping to run the meeting for any final remarks. Jody, Alice, and Cabello, any final remarks before we close out?
Nothing from my side.
Okay,
Only
Jody,
to say, yeah, thank you for joining, and hopefully we see you as part of the working group.
Yes,
Alice?
Thank you from our side. Thank you to all the facilitators. I know it's very, everyone's very busy doing their regular jobs and preparing for these sessions. I hope this was a good exercise for those of you who joined. we appreciate, your thoughts, and hopefully it's just sparked some additional thinking and potential interest in engaging in the working group. Perhaps, Derek, I'm going to steal your thunder a little bit. This is an informal working group that's been meeting, but there will be a formal call for experts coming from WHO, any day now, or I'm not sure if you will just skip the holidays and then launch it in January. Derek, would you like to say something about that?
Thank you very much. So we are working on releasing a global competency framework, and you're welcome to look at the WHO Digital Health and Innovation Department website. The call will be coming out in December. It will run through January. We would encourage each of you to look out to that call and register if interested to work in the formal convening. Thank you so much, Alice, for raising that.
And one more note, we don't have it here on this slide, but since the time here that we normally meet is not exactly the best time for the Asia time zone, we are planning in the new year to schedule once a month a meeting that's better for Asia. So then we can be a bit more inclusive. All right. Any other? I think we probably would like to hear more from the group, but I know we are probably going to be cut off soon. So again, thank you so much. Hope we can stay connected, and hope this was educational and useful for you. And have a good rest of the conference and rest of the week. Hope to see you around. Take care.